A question that I'm getting with increasing frequency is what about stem cells for my knee or shoulder or elbow? And it's important to understand that stem cells aren't really one treatment. That's sort of a more broadly what we call OrthoBiologics. And there's a number of agents that have stem cells. But that can be more broadly anything that has sort of growth factors that might kind of positively influence the biology of a joint or musculoskeletal tissue that's trying to heal. One, probably the most common that we use, is something called platelet-rich plasma, where we draw blood, peripheral blood from a vein, just like you would donate at the blood bank or give labs to your primary care physician. And it gets spun in a centrifuge, and we separate out a concentration of platelets, which are little particles in the blood. And when you have an injury, they release a burst of growth factors, and that initiates kind of a healing cascade. So for some orthopedic conditions, there is some research suggesting that this growth factor release can have a positive effect for pain relief or in some cases kind of promote healing from injury or after surgery. Another agent that we use, particularly in surgery, is something called bone marrow concentrate, where we actually take bone marrow, typically out of the brim of the pelvis, and similarly process it to get a concentration of mesenchymal stem cells and some other growth factors that are active. And there is some research supporting use in specific orthopedic conditions to promote healing. Now, it is important to understand these therapies are really kind of on the frontier of our field right now, and so a lot more research needs to be done to determine best practices and figure out who's really a candidate or who's going to benefit from the most versus when it may not be as efficacious as other treatments, or if something is sort of beyond the realm of biologics. In a lot of ways, I think the best uses of these therapies is actually to augment the healing of orthopedic conditions in surgery, where we're trying to bolster the local healing response of tissue. Finally, there are kind of donor products as well, and a lot of those are newer. Anecdotally, I've kind of heard about an increasing number of people receiving these treatments, and some more work needs to be done there. But all of these are very promising for the future, but we'll need a lot of research to kind of support their use as well. So if you have an interest, please come in and see us.